Hey everyone, welcome back to the channel. So today we are going to be talking about something very crucial, the medical standards for AFMC admission. I know many of you are preparing for it, and trust me, there is nothing worse than clearing NEET, acing the entire interview process and then getting disqualified due to a medical issue. So let's go over everything you need to know to ensure you're fit for AFMC. The candidate must be physically and mentally healthy, and that will be evaluated by the medical board at AFMC Pune. So you'll have to physically report here and get the examinations done. So after examination, you will be grouped into two categories. Either you'll be fit or unfit. So if you're unfit, you can appeal within 24 hours. So that means you'll have to appeal either on the same day or the very next day. You'll have to pay a nominal charge of 40 rupees and you can appeal. But keep in mind, any appeal via phone or email will not be entertained. They'll be invalid. You'll have to report in person. Now let's talk about what exactly the medical board looks for. So you should not have any major skeletal deformities like scoliosis or spina bifida, no speech impairment, no heart or lung diseases, no active pulmonary TB infection, and no digestive system abnormalities. So for active pulmonary TB infection and scoliosis, they'll do a chest x-ray and they'll find out whether you have these two conditions or not. Okay, so this is what scoliosis looks like. Scoliosis is basically sideways bending of your vertebral column. If the scoliosis is up to 15 degrees, that is not medically unfit. Anything beyond 15 is medically unfit. Similarly, kyphosis and lordosis are also medically unfit. Polydactyly, flat foot, knock knees, spina bifida, all of these are medically unfit. Now, as I said, for pulmonary TB infection, they'll be doing a chest x-ray. So this is what it's going to look like. So if you have pulmonary TB infection, that is medically unfit. So next up, you should not have any inguinal hernia, hydrocele or varicocele. And if you have had hernia surgery in the past, you'll have to prove to the medical board that 12 weeks have passed since the operation. General tone of your abdominal muscles, they have returned back. Your muscles are fully recovered. And thirdly, there has been no reoccurrence of the hernia since the operation. Female candidates will have to go through a separate gynecological and ultrasound examination. Okay. Now there are some more things that can get you disqualified. For example, fistula and piles, they are grounds for disqualification. Any disease of the kidney, including glycosuria and albuminuria. Any disease of the skin, okay, can get you disqualified. Latent or active or congenital STD infection, including HIV. There should not be any history of epilepsy or mental or psychiatric disorder. No squint. I'll talk about it later. I'll talk about what squint is. Or any other morbid conditions of eye or the eyelid. No active trachoma or enlarged glands. Okay. So as I said earlier, any skin disease, let's say for example psoriasis in this case, is medically unfit. If you have trachoma, that is also medically unfit. And if you have any generalized or localized swelling over your body, that is also medically unfit. Esotropia, exotropia, hypotropia or hypertropia, any kind of squint is ground for disqualification. Now let's talk about height weight criteria. So the minimum height required for male cadets is 157 centimeters and for female cadets it is 152 centimeters. You'll get a relaxation of 5 centimeters if you're from hills or northeastern states of India, and you'll get another 2 centimeter relaxation if you're below 18 years at the time of examination. Coming on to weight standards. Weight standard actually depends on two parameters, your height and your age at the time of examination. So we have something called weight, height, age chart. I'll just quickly show you the table. So this is what we follow at AFMC. You can take a screenshot of this table. Now let's understand this table with the help of an example. Let's say I'm 174 centimeter, 22-year-old male. So for my height, the minimum weight can be 51 kgs, and since I'm above 20 years, so the maximum weight can be 73 kgs. So the range comes out to be 51 to 73 kgs. Now anything below 51 or above 73 is medically unfit. Similarly, you can calculate for your height and age. Now, there is one exception to the height weight chart in the previous slide. It is applicable only in exceptional circumstances wherein the candidate can produce a documentary evidence of being a bodybuilder, wrestler, or a boxer. But in any case, you'll have to make sure your body mass index should not go beyond 27. So, body mass index is basically your weight in kgs upon height in meter square. Okay. This index should be below 27. Hip waist ratio should be below 0.9 for males and 0.8 for females. Waist circumference should be less than 94 centimeters for males and 89 for females. And all biochemical parameters should be within the normal limits. Let's say, for example, your LDL, VLDL. So all these biochemical parameters should be within the normal range. Now let's talk about eye and vision standards. Your uncorrected vision, that is your vision without glasses, should be 6 by 36 or better. Ideally, it should be 6 by 6, but even if you have 6 by 9 or let's say 6 by 18, these values are also within acceptable limits. But your corrected vision, that is your vision with glasses, should be 6 by 6. So whatever defect you have in your eyeball, it should be refractive in nature only. Any defect pertaining to your optic tract are grounds for disqualification. So whatever defect you have in your eyeball, it should be refractive in nature only. Refractive errors can be myopia or hypermetropia. So if you have myopia, it should be within minus 3.5 diopters, and hypermetropia similarly should be within plus 3 diopters, 3.5. You should not have any active trachoma or any related complication. LASIK is not permitted below 20 years of age. Now, if you're planning for a LASIK surgery to correct a refractive error, you should have the following things in mind. Firstly, your age at the time of surgery should be above 20 years. Secondly, there should be a gap of at least 12 months between your medical examination at AFMC Pune and your surgery. Thirdly, the corneal thickness should be above 450 micrometers and your axial length should be less than 26 millimeters. Now let's talk about dental and ENT standards. We need at least 14 dental points to qualify. The calculation is pretty simple. We have 4 types of teeth: incisor, canine, premolar, and molar. Incisor, canine, and premolar hold 1 point provided their corresponding lower teeth are present. First, second molar and well-developed third molar hold 2 points provided they are in good opposition to the corresponding teeth in the lower jaw. If the third molar is not well developed, it holds only 1 point. Any severe gum disease or advanced dental caries are grounds for disqualification. Any ear discharge, tympanic membrane perforation, obstructive wax, or nasal septum perforation are again grounds for disqualification. Now let's talk about hearing standards for medical fitness. The primary test used is forced whisper test. One person will stand next to you and create a background noise by scratching a cardboard near your ear. This is done to muffle sound in that ear. Meanwhile, an examiner will stand exactly 6.1 meter away and whisper familiar words in a forced manner. You'll need to correctly repeat the words whispered by the examiner. This ensures that even with background noise, your hearing is good enough to pick up speech from a distance. Now, if there is any doubt about your hearing, they might also perform an audiometry to evaluate your hearing at different frequencies and volumes. And for borderline cases, they may also do a detailed hearing test. Alright, now let's go over to some final notes regarding the medical standards. First of all, medical standards are subject to change, so make sure you check the latest guidelines before applying. Secondly, it is highly recommended that candidates undergo a preliminary medical checkup before applying. This will help you identify any issues in advance, and it will give you sufficient time to address the problem before coming to the official medical exam. Also, if you are declared unfit, there is an appeal board where you can challenge the decision, but beyond that, no further appeals are allowed. So if you are medically rejected after the appeal, that's final. And with that, we have covered everything in the medical standards. If you have any doubts or queries, feel free to drop in the comment section. I'll try my best to help you out. Thank you so much. Jai Hind.